Hi, my name is Andrea Plichta, and I'm an acupuncturist and a Chinese herbalist. And I'm here at 8 Elements West, and I'm going to do a demonstration of how a basic acupuncture treatment works. We're picking up right now after the initial diagnosis that I would have done, where I would get the patient's history intake and then check the pulses and then do abdominal readings to build up my treatment plan. So here what I have now is my patient on the table, and just to kind of show you what I do is going through more of a Japanese style. I diagnose through these back points which go along her spinal column and feeling for any tension, any resistance that she might have, and coming all the way down to the hip and coming over the other side. Again, you can start to feel where patients hold their tension, and that will often be a confirmation as to what acupoints I will choose. The reason doing this is a lot of different concepts for how acupuncture works. Some say dealing with the parasympathetic, sympathetic nervous system. These points have a lot to do with the innervation of internal organs via the dermatomes, as well as can have places where nerves will either originate or end, as well as blood vessels. So we're basically working on the electrical circulation of movement through the body. So going here, just to let you all know, the needles are single use only, and actually before I do this, we'll just go ahead and use an alcohol swipe just to prepare the skin on the points that I have seen appropriate for the treatment. And then again, needles are single use, disposable. We don't reuse the needles at all. And what patients often feel during a treatment would be maybe like a downward bearing pressure. It's not painful at all. I always say that a paper cut is so much worse than an acupuncture treatment. And I know so many people are needle resistant, and you have to understand that these needles are about as thin as a piece of hair, and really you can't feel them. If people knew how painless this treatment was, more people would definitely be coming in for work. A lot of times in my treatment I will do both acupuncture and then a herbal prescription as well, but today we're just sticking with the acupuncture. Going in through the dermal layer into the tissue. This is a great way, again, it's been used just for trigger points to help with tight muscles, but this is more also based to deal with internal medicine. If I need to stimulate or turn certain organs on and off via their nerve pathway coming off of the vertebra, this is where I start, and then I'll flip the patient over and I do front and back treatments. So we'll just come through and do a couple more. So very simple. How are you doing, Christina? Great. my lovely model here, Christina, demonstrating. So what I'm going to do is go right into, I use Moxa almost on every treatment. Moxa is short for moxibustion or heat therapy. This is a very gentle way to provide more information to the body during the treatment, and that's really what I'm trying to do, is to communicate to the body and to address areas that have hypersensitivity or hypo. And so what this is, it's an herb called, basic common American name would be mugwort, or its Latin name would be Artemisia vulgaris. And this is an old form called needle top moxa, where it goes directly on top of the needle. The heat will transfer down into the skin gently, again allowing for more information to come into the acupuncture point that I'm trying to stimulate. And it does cause a little bit of smoke. I do have, sometimes we'll use smokeless if patients are sensitive to the smell of smoke if they have allergies. But that's basically it. You let this go, it will again create a warming sensation. The way I look at it, it's very similar to what in ancient China, what would be considered like old school ultrasound. Again, the theory of heat application going down into the skin to help release tension, or again to add more information to a point that I need more than just via needle insertion alone. Okay, so the next one I'm going to show you is cupping, but I'm going to go ahead and remove the Moxa after that.